Good evening, everyone, and welcome to tonight's webinar on how to navigate the holiday season and what to do to prepare for your fertility journey in the new year. Tonight, we're joined by our webinar hosts, Melbourne IVF Fertility Specialist Associate Professor Megan Di Quinzio and our Fertility Counselling Manager, Amy Stevens. Amy, I'll leave it to you.
Hello, everyone, and welcome and thanks for joining us. We appreciate your time to go over just a few things. So there we are. That's what we look like. We wanted to talk about managing the holiday season. Again, while the holidays are filled with joy, excitement, there can also be a lot of mixed feelings about what you're going through, about what others are experiencing, and then you have to go and be happy when maybe you don't feel like being happy. Again, it's a really tough time with very mixed emotions for some of you or all of you out there. It's important that if you are trying to conceive during this time, that if you feel you can afford to, or if you want to, just take a break and stop, because there's so much going on externally that you can just take time for yourselves and to rest and rejuvenate during this time, because it can be such a high time of pressure for outside things, where inside and for your own personal lives, you can take that pressure off. Let's see what's next. We want to talk about your support system. Many of you have support systems already, but this is a very, very personal piece of medicine. You may not want your whole world to know. So recommend that you keep it a pretty small, intimate group that you share this information with. Because people and friends, people, particularly family members, your moms, your sisters, they are the ones that, because they love you and they know what you're doing, how's it going? What can I do for you? What do you need? And you may not want to tell them all. So you do not need to feel obligated to share your story with everyone you've told. So setting boundaries, we'll talk a little bit more about that later, but there are many people that you can go to with some information, go to share your heart with. Medical professionals, community forums, the counseling department here. We can all be of support to you in that time. And again, everyone is different. So how you reach out, how you need your time to be, but I really stress that you need to manage the story. It's your story to tell. Again, it's a piece of medicine. It's not a secret. And so you can manage it how you see fit. Okay. Seeking mental health care is super important during this time. See your GP if you need to. Use up the sessions before the end of the year. Have a plan in place, because again, it's an incredibly emotionally and stressful time. It's physically, financially, emotionally stressful. So have a plan in place for what you're going through in the new year. And if you're going through fertility treatment, seek out your care, seek out your fertility specialist, seek out your counselor. We at Melbourne IVF want you to have a baby. That's our goal, 100%. So reach out to us. We're happy to help when you want it and how you want it. Connecting with other people, again, creating that community for yourself, but managing that community, making sure it's people you want to share information with. Maybe someone's been through it before. Don't compare things, because again, things are never the same for one person or two people. But somebody who's been there, who knows, sometimes there's just a lot of comfort in that. Join your online communities and your forums, again, your IVF patient forum, and then access your support services and your networks, again, back through the GP, your mental health person, again, our department, just so you have some help, because it can be really draining. Your self-care, super important while you're here. Again, we'll talk a little bit about engaging in those self-care that bring you happiness, social time, spend time with your friends, families, and loved ones. I'm going to tell you right now that you can just say, hey, that lady said that night. Do not spend it with people that drain you if you can help it. It's because, again, you've got a lot of things that are already draining you. spending time with people that take more energy than they give. If you can avoid it, it's good to do so. Find your hobbies, reading, watching movies, listening, podcasts, creative hobbies. Those are really going to be things that build you up. The other thing that I really encourage people to do oftentimes is find something that has a closure to it, whether that be finishing a puzzle or finishing the video game, getting Zelda to the island or whatever that looks like, redoing your kitchen with a certain color paint or something like that, something that has a closure can make you feel in control of what's going on. Because again, this piece of medicine, you're giving away a lot of control to the doctor, to the counselors, to the nurse. And your control is taking the medicine right on time, doing things, making sure you have time for each other in your relationship. Those are your jobs, but you're giving away the control of what you want to other people. So find that control a different way, because that's really important to do. Be sure to exercise, walking, yoga, outdoor activities, mindfulness, if that's something that works for you, find those kind of things. Again, whatever has worked in the past can work again. So you want to make sure that works and have fun. On this slide, though, I want to make sure that you don't overdo it, because you can see this list of lovely things and you think, I've got to do this, I've got to do this, I've got to do this, I've got to do this. You can pick and choose. You don't have to do everything. Also, if you get too stressed by saying, I have to do, then back it up. You can overdo the good. Okay, so you don't have to drink the green smoothies every day or anything like that. Whatever you need to nurture yourself, take a step back if you're too intense with the fun. Okay, if that makes any sense, right? All right, plan ahead. So this is super important because you all are going to be going to, hopefully going to activities of some sort and parties and all sorts of things. Plan how you're going to answer those questions. Plan out how, you are going to answer when your great aunt says, oh, we don't need to have, are we going to have a baby? Maybe we're going to have a baby. Well, you should have a baby. You've been together so long. Manage those questions from the grandmas and the aunts. Again, set clear boundaries. I cannot stress it enough that the two of you are in this together and you can decide who to tell, who not to tell. It's a piece of medicine. If you were doing this naturally, you wouldn't be telling people the way you're doing it. So they don't need to know this either, unless you want them to. You control the message so that you then can control when you answer questions. But people who love you are going to ask because that's how they show they care. So recognize that. A good way to do it is just to say, hey, I love that you're interested. I'll reach out when I need something, but if I don't need anything, I'll just, let no news is good news for a while. Okay. And so just you can be direct to people who love you. It's those people that are on the outside of that closed circle who ask questions that you just have to say, yeah, one, it's not their business, but you can understand that we want to keep it private, or it's something we're thinking about. It's just between us. Those are good statements for that external circle, if that makes any sense. All right. All right. Why are we not falling pregnant? I'm going to pass the baton on to Megan and let her talk for the rest. I guess I will come back in at a couple places in the towards the end, but I'll let Megan have the rest of it from here. I'll close my window and she can open hers. Oh, is Megan there?
Yes, I'm here. Hello, everyone.
There you are.
Yeah, thanks for joining this evening. So obviously I'm going to take on a medical aspect to this approach. So as I say, 1 in 6 couples have trouble conceiving naturally and will actually require fertility treatment to assist them on their journey. Next slide, please. And this is a not so comprehensive or comprehensive list of causes of infertility in couples. As I say, there are many other conditions there. This is just pointing out the most relevant ones. I would say for women, the commonest problem would be ovulatory disorders, and a good example of that is polycystic ovarian syndrome, where a woman will ovulate at very infrequent intervals, perhaps every 40 days, every 50 days. Endometriosis is another important condition affecting about 1 in 7 couples. And I'm just going to digress for a moment because I have had men ask me exactly what endometriosis is. Obviously, what happens every month is the endometrial cells that line the uterus, they normally grow and shed every month as a period. And what happens is those endometrial cells can actually move in a retrograde fashion out through the fallopian tubes, out into the pelvic cavity. And obviously they're under the same hormonal response as you know, your natural cycle, so they will grow and bleed every month. And in the pelvis, obviously, there's nowhere for the blood to go, so that can lead to scarring and block off tubes and cause all sorts of damage. So, as I say, that's an important cause of infertility. Having said that, not all women with endometriosis are infertile. Looking at men, look, the big issue is sperm production, and there can be failure of sperm production through central causes or testicular causes, outflow obstruction, sexual disorders, you know, erectile ejaculation issues. And if sperm antibodies are detected, that can cause impairment in a successful conception. Next slide, please. So age is everything. Age has a significant impact on a couple's chances of successful pregnancy. And for men, sperm quality does decline with age, and sperm motility number and morphology are affected. Now, having said that, men are fortunate in the sense that their sperm is turned over about every 74 days or so. And so therefore they're able to produce sperm well into their 80s, 90s, that sort of thing. But subtle DNA does, you know, occur along the way. Women are completely different. We are as old as our eggs. So we're born with about 1 to 2 million eggs at birth. It naturally drops with age, and by the time you start your reproductive period of your lifetime, you're down to about 400,000 eggs. So ample opportunity, if you like, to conceive a child. Now, if a woman doesn't go on the oral contraceptive pill to suppress ovulation, she'll ovulate 400 times during her reproductive lifetime until she reaches menopause. But as I say, it's the quality and number of eggs that are able to be collected through an IVF process that does decline with age. Next slide, please. So trying at home first, absolutely. And we need to obviously consider your current lifestyle factors and things that might impact your infertility in an adverse way, work, environmental stressors, those sorts of things. Now, stress, obviously, that's important. I think that we can't eliminate stress in our life. That's the reality of it all. But it's how you actually deal with stress. And as I say, Amy would have talked about, you know, mindfulness activities, those sorts of things, whatever works, getting out and sort of dealing with stress. Seeing your trusted GP to complete that preconception fertility test and optimising your chances of natural conception, and understanding your cycle. And I'll talk about those two in a bit more detail with the next few slides. Next slide, thanks. So general health for those trying to conceive. So body weight, that is important. Body mass index, that's a little bit controversial because obviously increased muscle mass can contribute to a higher body mass index. But really what you're aiming to do is make sure your weight is pretty much ideal. And obviously it becomes very individualised. This does apply to men as well as women. Smoking is bad. It's toxic to sperm and to eggs, and we, you know, encourage all of our patients to quit smoking. Alcohol consumption, the aim is for 5 standard drinks a week or less, and certainly once someone successfully conceived a child, you know, the safe limit of alcohol consumption is 0. Caffeine, well, I'm a caffeine junkie. I'm not sure about the rest of you, but yeah, our aim is really to keep your caffeine consumption to something that's moderate, 1 or less a day. And looking at drugs and steroids. So the use of anabolic steroids is interesting. It can actually impair sperm production. So that's important to avoid the use of anabolic steroids. Drugs, well, recreational drugs, yes, to avoid those, but also medications that you might be taking for other medical conditions. It's important that you speak to your GP about making sure that those medications are safe to take in pregnancy for women. Next slide, please. So, preconception fertility test for women, assessment for women. Look, bottom line is some basic fertility tests can be done, one of which is the anti-Müllerian hormone test, AMH. Now, AMH is produced by the ovaries from the granulosa cells of the ovaries, and it's an indirect reflection or marker of ovarian reserve. Now, it is suppressed in someone taking the oral contraceptive pill, and the range of normalities is quite staggering. I will say that someone with a low AMH, under about 5 or so, is not infertile. Women with a low AMH quite easily can conceive a child. We seem to have lost a few things coming through. We got any more? All right, so I'm just going to keep going because there's no, oh yes, ultrasound. So pelvic ultrasound, that's a really good test to have done just to exclude things such as endometriosis, and just having a good look at your uterus, presence of fibroids, your fallopian tubes, your ovaries in particular, antral follicle count. We'd like to confirm ovulation, so very simple day 21 progesterone test would be ordered. And then there's basic screening for sexually transmitted diseases, ensuring that your rubella immunity is up to date and your chickenpox immunity as well. And cervical screening tests, that's really important. And I'm just going to state that. Please be up to date with your cervical screening tests. You can actually go to your GP and do a self-test, and if you have normal results every 5 years, so that's important too. Now, preconception fertility tests for men, obviously the big one is the semen analysis, and that can be done at any regional local laboratory. Obviously, getting specialist testing through a fertility service such as here at my Melbourne IVF, there's a little bit more added to it, but just some basic bottom line information that's helpful for the man. Important to note the history of undescended testes or mumps or orchitis, and then the history of genital infections, as well as the standard STI screenings. Next slide, please. So, cycle tracking and identifying your fertile window. So ovulation is triggered by a surge of hormones, and in particularly it's the LH hormone that we're looking at. And this usually takes place 24 hours before ovulation. So you can use those clear blue sort of wee on a stick test to see when you're ovulating, and that picks up that LH surge that I'm talking about. Alternatively, if your GP is happy, there can be some blood or ultrasound monitoring to see when you actually ovulate. But I do think it's important to understand the physical signs of ovulation. And most importantly, it's a change in your cervical mucus. So it becomes a little bit like egg white. It's very slippery, a bit sort of stringy, it's clear, and that helps sperm, move in the right direction towards the egg for fertilization. Some women also notice they've got a bit of breast tenderness, a bit of breast fullness, an increased libido as well. That can happen as well. So important that, as I say, with ovulation detection kits, I think if you really have no signs and you really don't know what's going on, that can be helpful. But as I say, it can have negative impacts down the track. Next slide, please. So tips when trying to conceive, right. Sperm can survive in the genital tract. I usually say about 4 or 5 days, but can be up to 7 days. And as I was getting back to before with the ovulation tracking, it can cause unnecessary stress if you're looking at that little smiley face on the little detector kit and getting stressed thinking, am I ovulating or not? So as I say, for the first few months, it might be helpful if you have no signs, but certainly beyond that, I think you need to look at what your body's naturally doing. You need to remember that you're fertile for that week up until ovulation. So I would say to my patients, pretty much from when your period stops, having sex twice during the week and once on weekend, and that will capture that fertile window, given the fact that sperm can survive for many days in the genital tract. And most important thing is, 80% of couples are pregnant after 6 ovulations. And the important thing is to keep going because, you know, for women and couples under the age of 34, 94% will be pregnant after 2 years. So that's pretty good. So I think we're summarising key points, yes. So important for the couple to improve your health, your diet and your lifestyle. And as I say, it's important you make that commitment. Multivitamins, particularly folic acid for women, is a great thing to start. And also for men, Menavit is the alternative. That has a bit of extra zinc in it, so that can be quite good. It's a powerful antioxidant. And then, as I say, speaking to your GP to make sure that you've got your current medications all sorted with regards to, you know, falling pregnant. And as I mentioned, understanding your pregnancy window and the best time for, you know, having sexual intercourse, and of course, your preconception health fertility assessment through your GP. So when to see a specialist? So if you're under the age of 36 and trying for more than 12 months, then you should seek help. If you're over 36 and trying for over 6 months, then yes, you should seek help. And obviously, if there's anything, you know, apparent like extremely irregular periods, obviously a low sperm count, you know, any serious gynecological symptoms. And it's important that your GP has both people on the referral slip, both patients, as I say, because that way you can maximise your Medicare rebate. Next slide. All right, so what are our options if we need help conceiving? So we're moving beyond, you know, conceiving at home. So your fertility specialist will work with you to create a tailored treatment plan that best suits your needs and personal situation. And it's important to note that IVF, so in vitro fertilisation, is not always required by every single couple. You know, and some will actually respond to other first-line treatments. And an example might be ovulation induction, where we're tracking a woman on scan to look at her follicle, and then obviously giving a trigger, and then timing intercourse, so having, you know, intercourse 4 days following ovulation, or intrauterine insemination, where we once again will track someone's follicle, as I say, the man will produce sperm, and then our lab will take it and actually, you know, make it really good. And as I say, then we you know, inseminate it into the uterus after giving a trigger. So we've tried everything, now what? So if you've been working with your fertility specialist to fall pregnant and you haven't had success, there are lots of options to consider. And I do think seeking a second opinion from another doctor or even from another fertility provider is worthwhile. I know here at Melbourne IVF, we have a special monthly meeting where we will discuss slightly more complex cases, sort of a bit of the brains trust, if you like. The other option is to consider, if you haven't already done so, pre-implantation genetic testing of your little embryos to make sure they're genetically normal or not. And the other option is to consider accessing our donor bank here at Melbourne IVF, where you can access donor sperm, donor eggs, or donor embryos. Next slide. So, important thing to remember is IVF success, in vitro fertilisation success, is cumulative, all right? So you can see in every single age group, obviously the little, you know, histograms go up, and as I say, cumulative success with up to 3 cycles. What you do see also, unfortunately, is that there is a decline, as you say, with age. And as you can see, you know, women at the age of 42 or 43 have a fairly low chance, but still it is cumulative. Next slide, please. So trying alternative therapies. Well, it's interesting, you know, current research does not support the fact that alternative therapies directly impact pregnancy, you know, success, fertility. Having said that, I think anything that improves your mental health, your well-being, and as I say, reduces stress in many ways, it's bound to have a positive impact and can potentially increase your chances of success. You know, positive, as I say, impacts, you know, positive physiology. Next slide, please. So what practical things should we consider? Well, Financial, that's one aspect of it. And I'm always going to suggest that couples might want to think about joining their Medicare cards to maximise the Medicare rebate and obviously maximise the safety net threshold. I would always say to my patients to speak to our patient liaison administrators, or PLAs as we refer to them here. They are pretty much the glue that holds Melbourne IVF together in many ways. And obviously there are different aspects of how you can access funds, and also whether you have private health insurance or not. It's important to understand whether they cover you for certain sort of fertility treatments, day hospital fees and anaesthesis fees and so forth. Next slide, please. So personal, I think Amy sort of touched on a few aspects of this. Obviously researching and educating yourself on your options and reaching out to family and friends to create a clear support network. Next slide, please. Workplace, it is important that you speak to your employer and who may vouch, or a trusted colleague who may vouch for you and support you during your journey, and understanding the leave policy that relates to the business where you work. You may need additional days of leave, and it's important that you would discuss things such as flexible working arrangements to best support you on your fertility journey. So remember, you're not alone. There are people and services who can help you on your journey. Next slide, please. And here is the fertility trifecta. So emotional, physical, and financial. So emotionally, you need to create a support network, find ways that work for you to minimise your stress, and do have fun with your partner. From a physical perspective, you want to optimise you and your partner's general health and well-being and minimise any lifestyle factors that may adversely impact on your fertility. And the financial aspect of it is, researching your options, identifying insurance providers that can best support you, and seek out financial support from those providers. Next slide, please. So next steps. Obviously, if you're interested in taking the step with Melbourne IVF, you can call us on the 1800 number or scan the QR code. And we welcome you to our wonderful family. Next slide, please.
You want me to leave up the code for a minute, or we'll go back to that? Okay.
Okay.
Yeah, we'll go.
Yeah.
Well, either way.
I think it will be sent out to all of our attendees this evening. So.
Okay, that's great then. Yeah. I think that's all the slides. I think that's the slides. So now if there's any questions, we were going to look and see if there are any questions. I don't have the Q&A section anymore now that I've got the, there's one. Hold on.
Okay.
Yeah, there's one. How do you suggest to manage the stress on your relationship? All right, you want to go, Megan? So one, it is very stressful to go through treatment. It's really difficult. Remember that the two of you are going to be, let me move I can see my picture or not. I'll tell you this. The two of you are going to be at two places. You're going to be, one time one of you is going to feel guilty because it's your sperm or your endometriosis or your things. You've got to try to recognize that you're going to be at different places at different times. Take a step back. And I really recommend that one of the things that you do is not make infertility or your treatment or trying to have a baby the center of your world. Keep it about 15 to 20 minutes of conversation a day, because you would have gotten on Google and looked at this, and then you just become all obsessed. It's important that you recognize that the relationship is going to need to help and be maintained. So take a step back from the journey and focus on the relationship if you can, and just let it be. Recognizing again that the stress can come from money, it can come from the emotion, it can come from being too focused. So try to take a step back if you can. So, well, that's my first help. Otherwise, you can try to get some support around it too, whether that be couples therapies or following up with us. So. The next question is, what is the Medicare threshold and what happens when the threshold is met? I do not know that answer. Megan, do you know that answer?
That is a good one. I would love to say the PLAs can sort that one out. Obviously, you'd be claiming a certain amount back from Medicare for the number of procedures that you go through, and you'll reach a point where our Medicare safety net steps in. And I think the threshold is obviously, several $1,000s. Once you're beyond that, I think you get like something like an 80% rebate or return. It's quite advantageous. And often, couples will look to reaching the threshold by the end of the year. So that can often be the case. But yeah, obviously our PLAs are the people to speak to about that. They know it all about upside down, backside, front, inside out.
Yeah, they do. They do.
Yep.
Yep. And if we said something, it could be changing too. So, the next one, what resources are available for women who need pharmacogenetic tests due to IVF sensitivity?
Pharmacogenetic test. I'm not quite sure.
Genetic test due to pharmacogenetic test due to IVF sensitivity. I don't know that I'm familiar with that.
And I don't know if I'm completely familiar with that either.
We may have to get back to you.
Yeah, genetic testing, obviously, that is an important aspect of it. And obviously, if you're looking at testing an embryo, as a pre-implantation genetic testing, that's one important step. There's a whole aspect
of medicine sensitivity. Medicine sensitivity, I think, is what he meant. Like if they're sensitive to certain type of medicines. Yeah, they're sensitive. What resources are available for women who are sensitive to pharmacy, to medicine? Yeah.
So are you talking about the medications that you would be injecting?
Yeah, I think that's the point. Yeah.
Yeah.
I think that what sensitivity, yeah.
So obviously there's a panel of different IVF drugs that we would use. And it is stated that they're all pretty much equivalent, but as I say, from IVF doctors, we can sort of assume that some are better or stronger, or have other hormones in it, just FSH or LH, the manipulation of the two. But as I say, that question is not entirely clear.
Yeah, sorry, it's maybe my reading too. Does IVF accelerate egg quality decline, i.e., lower the number of eggs quicker as you are retrieving so many eggs at each egg collection?
Absolutely not. As I said, we're born with, 1 to 2 million eggs. We're down to about 400,000 by the time you start your reproductive period of your life. So it doesn't bring on menopause sooner. If anything, the IVF process, so that controlled hyperstimulation process that encourages more than one follicle to grow and develop, is a way of almost like saving the eggs that would have naturally died off, because we recruit probably perhaps about 10 or so follicles each month, and as I say, we now want to recruit them all and have them all perfect little eggs to collect. So as I say, it's obviously beneficial, I would say.
Mm-hmm. Mm-hmm. Yep, and I think that's all the questions. Oh, are there any genetic tests that may assist in fertility assessment?
So there is one genetic test that can be offered to a couple. We refer to it at Virtus Health as a duo genetic test. So it's testing for obviously significant conditions that can affect everything from implantation to recurrent miscarriage to stillbirth, and obviously serious impacts on children. And it sort of tests, a panel of genes, but it's done as a couple. All right. So obviously it's not an individual test on one person or the other. There are separate tests that can be done for, a couple, that's for an individual that's looking at perhaps, single parent by choice, those sorts of things. But as I say, the couple test, that can be important too. And it really looks for conditions that, can obviously have a serious impact on fertility. So that's always an important aspect of, going through all the steps with the process of with IVF.
All right, so the next question is, what is the percentage of fertilization with the first round of egg retrieval?
That is a really good question, and that will always depend on age. Younger eggs are better eggs. So generally speaking, fertilization will obviously be better. But yeah, as I say, I think that's really what it's all about. But it is cumulative, as I say. That's the point with IVF, cumulative.
All right, so this one is another one we may have to have explained. If we are looking to be a SMBC, how does the sperm shopping part work? Do you know the
SMBC.
SMBC? How does the shopping part work? And shopping is in quotes. The sperm shopping part work.
That I'm not certain about. The acronym SMB.
Solo mother by choice. There you go.
Right.
Sorry. I haven't seen that one.
These are great acronyms out there, right?
Yes, what you're speaking about is being a single person looking for a donor, and our donor program is it's not like shopping necessarily. We have a selection of donors that graciously give of themselves, then their time and their energy, and make a lifetime commitment to being a donor, and then they provide a profile. So you would do counseling, the donor does counseling, and then when you are ready and have done all the counseling, you then are presented with a passcode to see the donors that are available, and you choose from those donors. So that's how it works. So I hope that makes it is a good answer for you. That works. Okay.
Yeah.
So is DQ alpha gene testing important for conceiving? Does a partial match cause a miscarriage? DQ alpha gene.
Wow, that's quite a complex question, isn't it? Obviously, yeah, partial matching, little bit hard to say. There are many causes of miscarriage. So, but yeah, genetic screening, that's important, as I say, in terms of, leaving no stone unturned, in terms of compatibility for sperm and egg to get together and create a new little individual.
Yeah. Yeah. So the next question, is there a shortage of Caucasian sperm donors? I've heard this on the Facebook IVF forum. I don't know that there's a shortage. I will say that they are the most in demand. And so at times they'll be low, and then there'll be some people, the sperm donors get cleared. Sometimes they get cleared in a bunch, sometimes they trickle in, but they are constantly rolling over to the amount of donors that we have. But they are in demand. Yes. Whether again it's a shortage, I wouldn't necessarily call it a shortage. I would just say that they are in demand.
Yeah, and I would think it's also different times of the year as well. As I say, that can always often play a factor in someone's ability to go through counselling and do the donor process.
Yeah. Yeah. All right. Any other questions? Is it possible to genetically test eggs and sperm as well as embryos?
Okay, so there's no genetic testing available for eggs, for egg quality. That's the issue, and there is no genetic test that you can do on sperm, but certainly embryos. Mind you, it's a very active area of research, so that there's that as I say, moving forward in great leaps and bounds. But at the moment, we're really just testing embryos. So we create a nice little day 5 embryo. We take a little biopsy of a few cells from the embryo. We then freeze the little embryo, and we do genetic testing on the separate little set of cells.
So the next one is there a limit to the number of times a donor can donate with potential siblings? So yes, there is in Australia, you are allowed to donate, as Victoria, you are allowed to donate to 10 women. Now, that has to include their own family, the donor's own family. And so, they top out at 8 or 9. And then they can have children with those 9 women. And then once you have a child with that sperm donor, you have a permanent allocation to that donor, so you can have a genetic sibling with that donor. So I hope that answered the question. The next one is, with PGT testing, is there a higher rate of the embryo not surviving?
So there's always a small risk associated with testing an embryo. And as I say, the embryo may not survive the actual process of, removing the few cells from the actual blastocyst. And we would often say, there's about a 2% chance of a false positive rate and 2% chance of a false negative rate. But having said all that, if the test successfully goes through and it's a genetically normal embryo, then when it comes to embryo transfer, the risk of miscarriage is substantially reduced. So that's an important point to remember.
Great. All right. Any others? I think we've answered most of them. So there's no questions. So, well, I think we are finished. Thank you very much for joining us tonight. And again, your questions don't have to stop here. You can always call and ask other questions should you have them. So thank you very much. Thanks for joining us.
Happy holidays.
Yes, thank you. Happy holidays. Bye-bye.